What do DAS28, CDAI, and SDAI mean for seronegative RA? Imagine trying to measure how active a fire is without seeing the flames directly. Rheumatologists face a similar challenge when assessing seronegative rheumatoid arthritis. They use special tools called disease activity scores to get a clear picture of how the disease is progressing. These scores are DAS28, CDAI, and SDAI. They help doctors decide if a treatment is working or if adjustments are needed. Let's explore what each of these scores involves and why they matter for seronegative RA. DAS28 stands for Disease Activity Score using 28 joints. It looks at how tender and swollen these 28 joints are, combines that with how the patient feels overall, and adds a lab test result called erythrocyte sedimentation rate, or C-reactive protein. These lab tests measure inflammation in the body. The result is a number that shows how active the disease is. Higher scores mean more active disease, while lower scores suggest remission or low activity. CDAI, or Clinical Disease Activity Index, also counts tender and swollen joints out of the same 28 joints. But it does not include any lab tests. Instead, it adds the patient's own assessment of their disease and the doctor's evaluation. This makes CDAI a quick and straightforward tool that can be used right during a clinic visit without waiting for lab results. It's especially useful in seronegative RA because it focuses solely on clinical signs and patient feelings, which can sometimes be more reliable when lab markers are less clear. SDAI, or Simplified Disease Activity Index, is similar to CDAI but includes a lab test called C-reactive protein. This addition provides a more complete picture of inflammation. In seronegative RA, where inflammation might not always be obvious or might fluctuate, SDAI can help give a balanced view by combining clinical signs with lab data. In seronegative RA, these scores are particularly helpful because the absence of rheumatoid factor or anti-CCP antibodies can make disease activity harder to gauge. For example, DAS28 and SDAI include lab tests that might be influenced by other conditions, which can sometimes lead to overestimating disease activity. CDAI, on the other hand, relies solely on clinical assessment and patient input, making it a useful tool when lab results are unreliable or normal despite symptoms. Doctors often prefer CDAI for quick assessments because it doesn't require waiting for blood tests. This allows for immediate decision-making during a visit. SDAI offers a good balance by including lab data, which can be helpful if inflammation markers are elevated. Overall, these scores are valuable for tracking disease over time, guiding treatment choices, and aiming for remission or low disease activity. It's important to remember that these scores are just tools to support clinical judgment. They should always be interpreted alongside a patient's overall health and symptoms. In seronegative RA, where disease signs can be subtle or atypical, using these scores regularly helps ensure that treatment is tailored to each individual. Always consult with a healthcare professional to understand what these scores mean for your specific situation. They are part of a comprehensive approach to managing rheumatoid arthritis effectively and safely.